Hi.
Lucy.
Yes.
Andy Williams, how are you?
Hi, Andy. I'm good. Thank you.
Come in. How are you feeling today?
I'm good, thank you. Yeah.
Lucy, this is Sabella. She's going to be my assistant for today.
Hi, Lucy.
Have a seat.
Thank you.
Okay. So you've been referred to me from the hospital.
Yep, that's right.
And you've just completed the cardiac rehabilitation
Yep.
program there. Do you have a referral
I
form?
do. Yep.
Thank you. Just be a minute while I have a quick look at this. Okay, so you've had a heart attack previously and then had a stent put in.
Yep, that's right.
And how long ago was the heart attack?
It was about 4 months ago.
About 4 months ago. Okay. So, and then since that time, you've been through the cardiac rehabilitation program at the hospital, and according to this, finished about a fortnight ago with that program. Okay. In terms of other conditions, it's also got that you've got angina here.
Yeah, I still get a bit of angina.
Okay.
I've got medication for that still.
Alright, so what medication are you on for that? Spray.
It's a spray.
The spray?
It's a spray. I didn't know if you wanted to drink that, sorry.
Okay, so, alright, so you've got a spray for your angina. And how often do you find that's a problem? Is that just a problem during exercise?
Mainly exercise, I've found. Yeah, no. Still getting things under control. Trying to improve my fitness.
Have you found that you've had to use it very often?
It's variable still.
Alright. We've got asthma listed here.
Yeah, it's not bad asthma. I think it's probably an allergy or something.
Okay, so it doesn't come on during exercise or anything like that?
Not really.
Not really? Okay. And what do you take?
I've got a pump that I use.
Okay, so salbutamol?
Yeah.
Sound right? Yeah, okay, we've got that listed here as a medication. Alright, in terms of medications, a number listed for your asthma, also for your cardiovascular disease. One is a beta blocker, so we need to look with the exercise test today about your heart rate. Is there any other conditions that you can think of that I might not have listed here that may affect your ability to exercise or that I should know about?
No, not really.
So no musculoskeletal conditions, arthritis or anything like that that might make certain types of exercise painful?
No.
Okay. In terms of current exercise habits, what are you currently doing?
Well,
in exercise point of view?
walking fairly regularly, once a day.
Okay. About how long?
About half an hour.
Okay.
And getting back into playing bowls
Alright. How often do you play bowls?
twice a week.
Okay. You obviously enjoy that?
I did before I had a tattoo, so enjoyable social as well.
So things like that would be, from an exercise prescription point of view, sort of things that you enjoy doing?
I enjoyed it a lot, and that's one of the reasons I can't. It's finding it harder to do what I used to do.
Okay. Okay, so I think what we'll do today then, Lucy, is that we're going to run an exercise test to determine, I guess, what your current levels of fitness are like. I guess to try and determine as well if there is a threshold for your angina that you're unaware of, so that any exercise I prescribe can be below that angina level. So in a few minutes, after we've taken some other baseline measures, we'll go and get you set up. Now we've got a couple of options today. We could do the exercise test on the treadmill or the bike. I think the bike is probably better. Would you be happy to do a test on the bike? Okay, so you're happy with that? Alright, now for the exercise test I'll explain in a little bit more detail shortly, but it will involve you wearing a mouthpiece on your face because we want to collect your expired gases. And that will tell us a little bit more about your condition and how hard you're working. Are you happy with that?
You're right.
Right, and it will also involve an ECG, which I'm sure you would have had at the hospital. Are you happy if we set you up and we look at your heart rate there as well? Okay. Do you have any questions at this stage about what we need to do? What we're going to do?
I think I'll be alright. Can I sort of comment if I'm
Yeah,
experiencing
look,
problems?
plenty of opportunity to ask at any point throughout if you have any questions. During the test, it'll be a little bit hard because there'll be a mouthpiece in, but by all means, any time up to then or at the end, please just say if you've got a question. Okay. Sabella, could you go and set up a mouthpiece for me, please, with maybe a small mouthpiece with the rebreathing valve, and set it up so that the outlet is to the left side for the metabolic part. Thank you. Lucy, just before we go any further, I just want to get a blood pressure. So resting blood pressure, and measure your blood pressure again as we go through the exercise test, if that's all right. So I'm assuming you've had your blood pressure's been tested before. Do you know what it's like?
It's on the high side. 140 over 80.
Okay. Let's have a look and see what it's like today. So let's have your arm. Just get you to just rest your hand on the shoulder. Just give me a minute, I'll look at this. Okay. 142 on 84 today. It sounds like very similar to what it normally is.
Yeah.
What you've said. Just record that. Okay. What we need to go and do now is go and get a height and weight for you, and then we'll go and get you set up for the exercise test. Any other questions at this stage?
I can't.
Okay, let's go and get you set up. One thing I have forgotten before you stop that. I have to edit this in. Before we go and do that though, what I need to do, I guess, is get you to sign a consent form for today. So the reason we ask this, there's a number of factors. It needs to be clearly explained to you, I guess, that provision of exercise, we know that it's good for someone with your condition, but every time you do exercise, there's a slightly greater risk of you having another heart attack or another adverse event. So, but in the long term, the chronic effects of the exercise are going to be to make it much less likely for you to have a heart attack. So we just need to explain that and make that clear for you. And the second thing is, because I'm providing you with service here, that I need to be able to report your results for today and your exercise back to your GP and to other health professionals. And it's just covering us here that you're giving me permission to do the reporting that I need. So if you want to have a quick read of this, let me know if you've got any questions, and if you do, ask. And when you're happy with it, if you can just sign and date it here, please. Okay, thank you. Let's go. Alright, let's go and get your height and weight. Lucy, can I just get you to take your shoes off for me, please, and then we'll get your height and weight. Just want to stand up against the wall here. So facing me, just shuffle slightly to your right, feet together nice and close. Okay, So just get into the right position. And now a deep breath in for me. I'm just going to pull up gently. Okay, now hold it there. Okay, 170 centimetres exactly. Okay, now you get your weights next. So this is on and 0. If you just want to step onto the scales, and just hold it there until it's nice and steady for me. Okay, thank you very much.
Okay, the mouthpiece is ready.
Alright, Stella, can I get you to calibrate the bottom card?
Yep.
For me then, please. Okay, Lucy, what we're going to do now is we're going to set you up for the Ecg Electrodes. So it's going to involve placing 10 leads in various spaces on your chest. You've had that before, okay? And so we're then going to use that to look at your heart rate before exercise and then throughout the exercise test. So is that okay?
Yes.
Alright. Okay, Lucy, how are you feeling? Okay. What I'm going to do now is I just want to quickly check your resting ECG, make sure there's nothing there, gives me a baseline reading for the rest of the test. And in a minute, once I've done that, we'll get you up onto the bike, take you through the instructions for the exercise test today, and we'll go through the exercise test. Is that okay?
Yep.
Do you have any other questions at this stage? Okay. Okay, that looks pretty good. So, in a second, we'll get you up onto the bike. Just to explain what I'm going to do with the exercise test today first, before I get you onto the bike, right? We're going to do a submaximal test today. What that means is we're not going to ask you to make a maximal effort. We're just going to ask you to do a number of submaximal workloads, and I'll tell you what our criteria for stopping will be in a second. It will start at a low workload, 20 watts, and we will increase the workload every minute by 10 watts per minute. So it will be small jumps. Every minute throughout the test, I'll be looking at your ECG, checking everything's okay with that. I'll also be using the metabolic carbs to get an idea of what your VO2 or oxygen consumption is. And so, as I mentioned before, for that we're going to have to wear a mouthpiece, which is hanging on the treadmill at the moment, but I'll show you that in a minute.
Right.
And a nose clip. So it looks very glamorous, I'm afraid. Might feel a little bit uncomfortable, but it's only a short period of time. Okay? And in addition to that, towards the end of every minute, I'll be letting you know when we're about to increase the workload. But Sabella is also going to be showing you a couple of siege exertion scales. So have you seen either of these scales before?
I've seen, yes, when I was reading.
Okay, so both of them, or
I've seen that one.
you've seen this one? So, okay, so the 6 to 20 point scale. Just to quickly give you a refresher, in case you're unsure, 6 is no exertion at all, so sitting at home on the couch. 20 would be maximal effort you could ever imagine making. We would only expect really well-trained athletes to get there, and even so, they'd only be able to perform at that intensity for a few seconds. To give you a guideline in the middle, 13 or somewhat hard would be when you know you're working hard, you're breathing more heavily, you're probably starting to feel a little bit sweaty, but you're not working so hard that you couldn't hold a conversation with someone. So you could talk to someone in sentences, but you probably wouldn't be able to whistle, assuming you can, anyway. Okay, this scale, have you seen the angina scale before?
Yes.
Okay, so just again, just a refresher, what we're looking at is your degree of chest pain or angina here. Hopefully you don't get any today, but we will ask you each minute if it's not on the scale, so it's a 0, no chest pain, then you let us know. If you get to 2 to 3, that's where we would consider we need to stop the test. So that would be one of our criteria for stopping the test. And we then go and get your spray and actually get the opportunity to take that. Okay. Other reasons for stopping the test today, we will stop it at 17 on this 6 to 20 point scale when you get there. So we're not going to try and go take you to a full maximum. Or others might be if I see something that I'm a little bit worried about on the Ecg, or with the metabolic card that I feel that we need to stop the test for. Okay?
See how we go.
Alright then, so if you can take that, I'm sure you'll be fine. We'll look after you today, okay?
Right.
Alright, if you're ready, let's get you up and we'll get you set up for the bite. So just keep a hold of this, let me make sure you don't get that trapped on the chair. So if you just want to come up, step up to the bike. Isabella, can you help Lucy onto the bike and get the seat height set up?
It might be a little bit low for you, Lucy.
How's that feel? Better?
That's better.
Okay. How are you feeling?
All right.
Is that out of the way?
Okay.
Okay. Now, how's that looking, Isabella? What I'll just get you to do is just roll your legs over once or twice and just see how that feels. Does that feel comfortable? Because we can increase it. Looks like the seat height's a little bit low there. We could increase it a little bit. So if you're able to stand up on the pedals just for a minute, I'll just increase that seat height slightly. Oops. Okay. Let's try that. Just want to roll your legs over again. That looks a lot better. How does that feel?
Oh, it feels all right.
Okay. So, the next thing we're going to have to do in a minute is get you hooked up to the mouthpiece. So now, when you've got the mouthpiece on, you're not going to be able to talk to me. So, I just need to let you know about the ways in which you can communicate with us throughout the test. You're free to stop the test at any time. So, we've spoken about some criteria.
Yeah.
But any other reason you want to stop the test, you just say stop pedalling, stop the test, tell us, and as much as you can, take the mouthpiece out and the test is over.
Right.
Okay? Obviously, you won't be able to speak to us while you've got this mouthpiece in, so we've got some simple forms of communication as well, and we use hand signals. So we'll be trying to ask you questions fairly regularly, how you feel and so forth, you're able to do the next workload, and similar. And so the answers are there'll be as much as possible yes or no questions. So the answer will be for a yes, thumbs up,
Right.
for a no, thumbs down.
Okay.
If you're unsure or you think there's a little bit more information, we need to ask deeper, this sort of question, and then we can then ask a question to try and get further detail out of you from yes or no.
Okay.
Okay. So we've provided ratings of perceived exertion, the hand signals, the test protocol I've explained. When we get to the end of the test, when we stop, assuming there's no issues that we stop the test for, once you decide you want to stop, we'll stop the test. Sabella will take all the workload or all the resistance off the bike, and then we'll just get you pedaling slowly for a couple of minutes to recover. And at the end of that 2 minutes, we'll then help you off the bike, get you to sit down, and we'll monitor your recovery for several more minutes. Okay? Last chance, any further questions?
I can't think of any, and I'm sure I'm not happy.
Now this might be an issue with your glasses on, this coming over your head.
I can take them off.
Okay, if you want to give them to Sabella, she'll put them away safely for you. Okay, so want to do is place as though you're here, like so, and if you can put that into your mouth and you want to bite down on it like a snorkel. How's that feel? Feel okay? So we'll just tighten this up. Is it pulling like one side or another, or it's feeling comfortable?
As comfortable as it can.
Okay. Let me know if that if it is starting to pull, just get some information. Now I'm afraid it's not complete here because we need to make sure you're not breathing in or out through your nose, so we've got this very attractive nose clip to go on. Can you just try to breathe through your nose now for me? If you can, if you're getting any air in or out, just adjust it until you can. So that's all feeling okay? Alright, Sabella, are you happy to time this and let me know as we're getting towards the end of each minute?
Yep.
Okay, I will just finish setting the metabolic card up and make sure that we're getting some data.
You just let me know when you want to start.
Okay, that's giving us some data there. ECG's all looking okay. Resting heart rate's 82. Okay, how are you feeling, Laura? Ready to go? Alright. When you're ready then, if you can start rolling the legs over, please. And we want you to build up to a comfortable cadence. So ideally between about 60 and 80 on this scale here. So you're getting up to a good pedalling speed, and what that means is the resistance will be lower and it becomes less a test of strength later on in the test. Okay? So how's that feel? Yep, good. Okay. Just keep going with that. How are we going? Top? Yep, so you can start the clock now, Sabella.
Yep.
Seconds, so 45 seconds if you can show Laura the scales.
Now Lucy, how do you feel on that scale? Just point to the number that you feel you're working at. You're saying a 9? 9?
How about the angina scale?
And on this one, do you feel any chest pain at all? So 1.
So how are we time-wise, Stella?
We're at 1 minute. I'll put the resistance up by 10.
Okay, so we're about to take the resistance up. Lucy, okay? Straight up now. How's that feel? We're going to be able to complete a minute at that workload? Okay, good.
30 seconds. 1 minute. How are you feeling now, Lucy? And 11? And any chest pain? 1? Okay, we're at 2 minutes.
2 minutes?
We're going to
Okay, Lucy, you happy if we take you up to the next workload? Okay, good. So that workload's going up now, so Bella, can you tell her when it's there?
Yep. That's it, we're at 40.
Lucy, how are you feeling? Feeling okay?
It's 2:30. How are you feeling now, Lucy? We're at 13. Yeah. And chest pain, are you feeling anything? Still number 1.
Heart rate's 112. Okay, Lucy, in a minute we're going to take you, or in a few seconds we're going to take you up the next workload. You feel you're okay to take to another minute? Okay, doing really well. Keep it going.
Okay, we're at 50 watts. Okay, we're at 3:30.
Okay, how you feeling, Lucy? A bit unsure? Okay.
How are you feeling on here now? You're at 14. And how do you have any chest pain? You have some chest pain? It's bothering you? Number 2.
Is it really constricting chest pain? Okay, let's stop the test, Isabella. Can you take the workload up, please? Okay, just want to stop pedaling, Lucy. Okay. Take all of this off, so just take that out. How are you feeling? Isabella, can you please go and get her spray?
Yes.
Her handbag. How are you feeling? Still. Okay. Just swallow deep breaths. You're okay just sitting there at the moment?
Yes.
And once you're feeling a little bit better, we'll take you off, put you off the bike, and let you sit there. So while we're doing this, I'll just make sure these pedals are nice and loose. Okay, how are you feeling?
Yeah, that's
Okay for us to get you off the bike now?
Yes.
Okay, if you want to just, when you're ready, gently take your feet out of the pedals. Let's just smash your legs. Right. Okay, just let it come on their seat. Just start with it. Losing the section of this Ecg. How's that feeling now? Is that what's your angina now? It's reducing?
starting to reduce now.
Okay. ECGs is okay. Just keep going like this. Yeah. Still continuing to improve.
Yes, it's now good.
Where would you say you are on that scale? Would you be back to 1 or 0 yet?
Keep lying.
I'll keep you resting there for a couple more minutes. Right, Lucy, so that's 5 minutes following the test now. How are you feeling now as you
No, I'm feeling much better.
okay? And your ECG is looking back to normal now, so there's I think we're probably safe to give them the ECG now and let you go, but I would suggest that it's probably worth, we'll give you the ECG lead and the details of the test to take with you. It'd be a good idea to go back and visit your GP or when you see your cardiologist next. Are you seeing him soon?
I've got it next month.
Next month? Maybe see your GP a little bit sooner and give this result to them. I mean, I think for our exercise point of view, the we've established where the threshold is that the angina is coming in, so we should be okay to exercise you as long as we stay below that threshold. But I think it's something you should address with your medical practitioners as well. Okay. Before we unhook you, etc., do you have any other questions or any concerns about today?
No, I guess it's before I've got it, I think.
Okay. So that was, Isabella, can you just provide me with the data? That was a heart rate of about 110.
It was 112, and then we got to about 115 at an RPM 15.
Okay. So the advice would be for any exercise now then to stay at an RPM no greater than 13. And if you were to be measuring heart rate, do you have a heart rate monitor, or do you know how to measure your heart rate during exercise? Okay. Then stay at a heart rate of 100, under 100, just to be on the safe side, be below that threshold. Okay. And make sure you have your spray with you at all times in case you. Okay, Lucy. So I've got the data from today's test and information. I've got a printout of your Ecg here. What I will do is I will forward this information, the results of today's test, to both your cardiologist and GP, if you're okay with that. And just to reiterate, for any exercise you do between now and getting a report from them and future prescription that I give you, try and maintain below that angina threshold. So keep your heart rate to 100 beats per minute. You said you've got a heart rate monitor. And for your RPE, keep that down to no more than 12 or 13, 6 to 20 points stuck. Okay? Any questions?
No, I guess I'll take her in the back and
Alright, and you're feeling okay now? Alright to leave? No problems? Alright, well, thank you for your time today, and we'll see you again next time.
Thank you very much. Thank you.